I love supplements and I like talking about lupus. So today we're going to be talking about the 4 best supplements that you can take to help lupus. Before I continue, why don't you comment below and tell me what supplements you're taking for lupus. I would truly appreciate it if you can like this video and subscribe to my channel for support. Our goal is to lower inflammation in lupus patients. Lupus patients can manifest in so many different ways. You can have rashes, arthritis, chest pain, hair loss, ulcers in the mouth or nose, and lupus can also affect the major organs such as the brain, kidney, and heart. We have medications and biologics that can help lupus patients. But did you know that supplements can also help as well? Medications surely can help lupus patients, but they do come with a higher side effect profile. So that's where supplements can come in, because not only can they help, but they also have a lower side effect profile. So the first supplement we're gonna talk about is turmeric. I know you guys have heard a lot about turmeric, but did you know that turmeric has been studied in lupus? I have a personal connection with turmeric because I was actually running a study on turmeric and lupus when I was in training and fellowship in rheumatology. Unfortunately, I don't have results of that study because COVID cut it short. However, when I was doing that study, there was about 6,000 studies on turmeric at that time and only a couple of studies on lupus and turmeric. However, there has been a recent study on turmeric and lupus done on mice. And what they found, these mice that took turmeric versus the ones that didn't had less renal injury in their lupus patients. And what they found in the study was that the mice that took turmeric versus the ones that didn't had less kidney damage from lupus. There are other studies as well, but that was the most recent one in 2020. Alright, supplement number 2 is vitamin D. Vitamin D is also a hormone as well because it can control the flow of calcium in the blood. I cannot stress how important vitamin D is for lupus. The reason why vitamin D is so important because the receptors are in your gut cells and also your immune cells. And what the studies have shown overall is that a higher vitamin D level is linked to a lower lupus disease activity. So make sure your vitamin D levels are at least normal. For me personally, I like to have my patients near the upper end of normal for vitamin D because I want to make sure that their vitamin D levels are satisfactory. If you have it on the lower end of normal, the labs could be off and that could make you go even lower. In my opinion, vitamin D is probably the #1 most important supplement out of all the supplements I'll be talking about today. Supplement number 3, and that is NAC, also known as N-acetylcysteine. Have you heard of this supplement before? It's also used in the ER when patients have a Tylenol overdose. NAC, also known as N-acetylcysteine, is an antioxidant. It helps you fight free radicals in your body. Free radicals are generated when you are fighting inflammation, and it can be generated from encounters of bacteria, viruses, pollutants in the environment. And we want to bring down the free radical amount because if you have too much free radical, it can damage the cells. So NAC or N-acetylcysteine can fight that process. And they did do a study in 2023, this year, on lupus. And what they found was that when you take 1,800 milligrams of NAC, it did lower the lupus disease activity versus the group that didn't take NAC. So I like to prescribe NAC for a lot of my patients with autoimmune disease, not only lupus, but now that this study came out for lupus, I prescribe it even more. And remember, NAC turns into glutathione, and glutathione is one of our master antioxidants. And I'll be talking about glutathione more in the future. Glutathione is one of my favorite supplements because it could do so many good things for your body and fight free radicals. And supplement number 4, I'm gonna talk about omega-3 fatty acids. But here's the kicker. Not only is omega-3 fatty acids beneficial, but you can also take pro-resolving mediators, which is something that you may or may not have heard of. So first of all, omega-3 fatty acids can come from fish oil, fish, or algae oil. So if you're vegan or vegetarian, you can certainly take algae oil, which does have EPA and DHA, which is what we want out of the omega-3 fatty acids. Remember, omega-3 fatty acids are anti-inflammatory, and your omega-6 fatty acids are more your pro-inflammatory type of omegas. However, we do have a process of converting omega-3 fatty acids into the end product, which are protectants and resolvents, which help resolve inflammation. So you make protectants and resolvents naturally in the body when you're fighting inflammation, but you can get that also as a supplement. So if your epigenetics or your part of your genomics isn't ideal and you're not converting the fish oil omega-3 fatty acids to the end product, which is protectant resolvents, because your body's not that efficient at it, you can certainly take pro-resolving mediators, and that can come in the form of SPMs or SPM active. So I like to take this supplement because it does help with inflammation overall, and my genetics are not the best at converting omega-3s to the end product, so I like to take SPM active or pro-resolving mediators. So those are the 4 supplements that I like to use in lupus patients. Why don't you comment and tell me, out of these 4, which one do you take? Or which one were you surprised by? Like NAC, there's a new study this year that showed that 1800 milligrams did help patients. And I would really appreciate it if you could please like this video and subscribe to my channel so we can keep spreading awareness on integrative medicine and autoimmune disease.